Hello, Cameron. Welcome to the ERP lab. We're going to be doing an informed consent session. So I'm going to be sharing a presentation with you, and you're going to be filling out an informed consent document on Qualtrics for me. And I'll send that to you now in the chat. Let me know if you can open it up.
Sounds good. Yep, it opened up.
Okay, and are you able to see the presentation?
Yep, I can see it.
All right, perfect. So we're going to get started. We're going to be going over eligibility. We're going to be going over what's going to happen during the session, and then we're going to be going over any potential risks or anything that you should think about and consider. So we're going to start with eligibility. Are you fully vaccinated against COVID-19? If so, you can continue with us. If not, let me know. And you can ask me any questions about eligibility as we go. And yeah, let me know. I'm going to just be going over this here. So you must be 18 or older. You must be right-handed, and we're going to be you're going to be filling out a right-handedness kind of survey on Qualtrics later on. When you do, you're going to need to share your screen. So make sure you don't get to that point yet. But as long as you're as long as you're mostly right-handed, you're eligible. Must not have sensitive skin. No history of neurological disorders. Not taking psychotropic medication. And psychotropic medication can include anything like antidepressants, antipsychotics, anti-anxiety drugs. A lot of these things are very common, but they interfere with our default kind of brain waves that we're looking at. Must not have a fear or apprehension about syringes. That's something that's interesting here. The syringes are just tools that we use to transport gel. The syringes are blunt tipped and they do not touch your skin. And if they do, they just graze over, because all we do with the syringe is move gel. So the syringes are not going to take anything out of you. They're not going to be going in you. They're not even going to be tapped against you. We just move gel with them. But if you do have a fear of syringes, you can't be in the same room as them. You feel like if they're near you, you're going to have an anxiety attack or you're going to panic. You feel any anxiety, we don't want you to sign up for the study and get, anxious or anything. This is just going to be a very easy process. And this is something that we use to just transport gel. And the electrodes can be on your scalp. So we don't want you to have any like skin condition here where a little hurt or to have anything rubbed against your scalp. But the electrodes themselves have a rubber casing that we're going to go over that touches your skin. So the rubber is going to be touching your skin, not technically any metal electrode. But as long as the eligibility sounds good, we can continue. So how does that sound, Cameron?
All right, I think it sounds good. I just have one question about the sensitive skin. How come it's important to not have sensitive skin for this lab?
Okay, so the sensitive skin issue here would just be that we're going to use the blunt tip end of a cotton swab to basically remove the layer of dead skin cells and oils, and it's going to help us work down the gel that we're going to be using, this conductive gel, so that we can get good brain waves. So I actually have here, and I'll show you this later on as well. This is just a cotton swab that I have from my dorm, and I cut the end of it, and this is what it's going to look like. It's the blunt tip of this that's going to be interacting with your skin. So if you can do this motion on your skin here with a cotton swab here, and there's not pain associated with it, or there's no marks that are going to be there forever or anything like that. If you know that that's like something that isn't an issue, then generally that's fine. But yeah, if you feel like this would be an issue here, having this cotton swab or anything blunt tipped rubbing like with friction against your skin, if that seems to be a problem for you, then definitely don't sign up for the study, because we don't want you to be in any pain. But this generally does not result in any pain. But if you do have sensitive skin, it could be a problem. So yeah, if you feel like that might be a problem, like that's perfectly fine. Like you're still going to be rewarded the credit for the session, but it's something that would get in the way of the study.
All right, sounds good.
Okay, all right, so we'll continue here. So upon arrival at the ERP lab, we do ask you to wear a mask. We ask you to pass a temperature check, and you just have to be less than 100.4 degrees Fahrenheit there. And we ask that you wash your hands. And so the purpose of our research is pretty much to measure brain waves during a memory task. And to do this, you're going to be wearing an electrode cap to record your brain activity. And so this is the cap, and so this cap is made of Lyrica spandex, and the electrodes have that rubber casing that I mentioned before that sits on your skin. The top photo is what the cap looks like from the outside, and the bottom photo is what the cap looks like from the inside. And you can see here where the red arrow is pointing. that's where the electrode will be. That's the part of the electrode that's going to be touching your scalp. It's going to be that rubber part. And in between the rubber part that touches your scalp and the metal of the electrode is a little bit of space where that's where we're going to put the gel into the cap. So yeah, the space between the skin and the electrode is going to be filled with that conductive gel. It's made of salts and inert gelatin, and it's non-toxic, but it is a good conductor of electricity, and that's why we use it, because we want to pick up good brain waves. So the electrodes that are on your skin can pick up artifacts when the electrodes move around, and we try to get a cleaner signal with the gel. And we use the blunt tip syringe to suck up the gel and squirt it into the hole in the back of the electrode. So the bottom photo there with the red arrow, that shows basically where we aim the syringe. So we hover the syringe over the electrode, and what we do is we push the gel into the electrode, and then the gel is going to fill up that space between the rubber casing, or between the electrode and your skin. So again, the syringe hovers over that part of the cap, and we push in gel. So you're going to be feeling gel and an electrode cap. That's pretty much it for that part. So why we do this? So your skin is not a good conductor of electricity at the get-go. There's a layer of oil and dead skin cells that'll interfere with the flow of electricity coming from your brain, and that interference that we have here is called impedance. And what our job is to lower that impedance and get a good signal. And we're going to talk about how that works. So to get a clear signal, we're going to lower the impedance from around 1 mega ohm to down to below 5 kilo ohms. Now, this is something you don't need to know, but this is something that's relevant to us and that you're going to be seeing on this monitor here. So this is what you're going to see when you sit in the lab. This basically shows our impedance levels. We want to get them. So if you see the example here, F4 is red and it's above 100 kilo ohms. We want to get that to below 5. And we want it to be consistent. And to do that, we're going to be using the blunt tipped end of a cotton swab. And what we're going to do is do this butter churning motion like this. And we're going to remove that layer of oil and dead skin cells while moving the gel around in that area. And we're going to be getting a clear signal that way. And so, yeah, just the general electrode cap preparation. We're going to put the cap on. We're going to plug the cap in for you. We're going to clean off the facial electrode sites, and we're going to be attaching those. And then we're going to prepare the rest of the electrodes on the scalp. So you may be asking about facial electrodes. You might be like, what? I didn't even know that. So we're going to go over the facial electrodes here. And yeah, you don't want to get too worried about these, but I'm going to tell you right now, like pretty much what it is. There's going to be 6 electrodes on your skin. So there's going to be 2 references, one on each side of the outer part of your ear on this bone here. And then there's going to be 4 that go on your face. And they're not going to be like right directly next to your eye. They're going to be above and below your left eye and on each sides of your eye. But of course, not close enough where we're going to be, ever close enough to touch your eye with a cotton swab. We're going to be like around this area, or around this area, around this area, or around here. And so what we do is we use alcohol pads to clean the area. And then we do the same process as we're going to do with the electrodes on the scalp. We just fill up the electrode, like the space, we just put gel in it, and then we work it down. We do this butter churning motion like this. So the reason why we have the electrodes on your face here, on your eyes specifically, the ones on the side act as a reference for us, but the ones on your face, so your eyes generate electrical activity, and they're artifacts for us. So they're basically things that we're not trying to measure. We're trying to measure brain waves. Now, we're not trying to measure your eye activity. So we use these electrodes to basically subtract that activity out of our data. So it's something that is relevant for us. Like, we do need it. And so the last thing we're going to talk about is potential risks and discomforts. Of course, minor skin irritation is a potential risk. So red spots or small scabs the size of the end of a cotton swab may be present just because we work down the electrode like as so. So this, of course, is not something that always happens. This is something that we just say just in case, or if you do happen to have sensitive skin and you do end up coming to the lab, it is possible that you could have a little, like a little baby scab. So most scabs are not visible, but the ocular electrodes are on your face. So we just always want to make sure you're aware of that possibility. And the electrode preparation should not be painful. again, we stress this a lot. Like this study isn't about doing anything crazy with syringes or jabbing you with cotton swabs. What we do is we use gel and we use this blunt tipped end of the cotton swab to work gel down. And if that kind of motion feels uncomfortable on you, then we either ask you, if it feels mild, like it just feels like a little bit strange, please speak up. The lab participants, the research assistants are so sweet. They're very, very nice and personable and everything. I mean, it's always a good time when you're in the lab, but if anything does feel very like comforting or it hurts, you definitely don't want to participate. You can discontinue the study at any time and be awarded for the time that you were there. But yeah, if you do have sensitive skin, please don't participate. And hair tangles. So long hair may become tangled from the electrode preparation. It might require conditioner plus a detangling comb. We do give you a comb prior to putting on the cap and after if you do need it. But yeah, your hair could potentially be tangled by this kind of motion with the mixture of the gel. But the gel is a very kind of like a slimy substance. It's not like a super sticky mousse that'll stick to your hair and like it'll stick up and stay there forever. No, like the gel is like more of like a slimier substance. So it is something that can get out like with conditioner pretty easily. So you're gonna be earning Piper credits for the time that you are here with us. And so the ERP recording session usually takes about like 1.5 hours, but we schedule up to 2 hours to allow for technical delays. So you're going to technically earn 3 to 4 Piper credits for the lab session. And of course, you're going to be earning one right now for completing the consent session. And yeah, you can discontinue at any time and you'll be credited. Confidentiality. So in case you come in there, in case you come into the lab and you have COVID or you didn't have COVID and potentially you can transfer it to us, we may use your name and research appointment day and time just with TCNJ contact tracers just to just to follow up with that, just in case anything did happen. So do you have any questions about either eligibility, what's going to be happening during the session, or any potential risks or anything?
Yeah, I just had a question about the gel. Is it easy to get out of my hair once after the lab's finished?
Oh yeah. So we're gonna be giving you like a comb if you need it, and we're gonna have tissues, and we're gonna help you get some of the gel out of your hair. You can do it yourself, but you don't want to really go out after that. Like you're gonna want to wash your hair, or at least like put a towel through it because it could still hide in your hair, it could stay in your hair, but for sure it comes out very easily.
All right, sounds good.
Yeah, and so as you're going through your Qualtrics, right? Have you gotten to the hand in this inventory yet?
I'm just about to reach there.
Perfect. And again, take your time. And if you have any questions, let me know as you go.
Okay.
Once you get to the hand in this inventory, though, I want to ask you if you can share your screen so that I can just see that it's majority right-handed. And I'm going to stop sharing the presentation when you get to that point.
Okay. Yeah, I'm here now. I can share my screen.
Okay. So I'm going to stop right here. And so yeah, I just want to see really quick that hand in this inventory kind of shows up majority right-handed. All right, perfect. Yeah, any other information that you have, you don't have to share with me. You can end the screen sharing now. That's all I wanted to see there. Once you're done with this, you just fill out your demographic variables, and then you're going to be submitting your Qualtrics. So yeah, let me know when you're done submitting it, and then I will end off the presentation here with you.
All right, I'm all finished now.
All right, perfect. So now that you're done, and as long as you don't have any questions, we can continue. If you're ineligible for any reason, the lab manager will contact you. And I believe you scheduled a session prior to coming to the lab, but if you didn't, now you're going to be able to schedule one. And Now, since this presentation is done, I'm going to be sending you a follow-up email, just basically saying, make sure you come to the place wearing the mask, the lab wearing a mask, and I'm going to tell you where the lab is. And I'm going to write down your research time if you already signed up, just so everything's clear. So yeah, everything sound good, or do you have any other questions?
No, everything sounds good. Thank you very much.
Okay, cool. Yeah, no problem. All right, I hope you have a great lab session, Cameron.
All right, thank you. Appreciate
All
it.
right, bye.